Take it away, Marlysa. Thank you.
Thank you, Jessica. Hi, everyone. It's nice to see everyone. My name is Marlysa D. Gamblin. I'm the Senior Policy Advisor at Bread for the World Institute. For those of you who might know, Bread for the World is a Christian nonprofit that focuses on ending hunger, both domestically and internationally. We do so through policy and advocacy. And I have the pleasure of working in the policy the policy department, and you can think of it like that, the Institute, where I manage looking at the racial and gender divides as it pertains to hunger and income in the US. So welcome to this session where we'll be talking about racially equitable responses to COVID-19. Critically important, as many of you already know. For those of you who are familiar with me, you know that I like to give a roadmap of how we'll be spending our time together, and today's no different. First, we'll be focusing on understanding racial equity. I want to make sure that we're all on the same page. It's a buzzword that's kind of been going around, but I want to acknowledge that some people are starting from different points. The second thing that we'll be talking about is the Racial Equity Policy and Program Scorecard Tool that I designed I designed a year ago, but I kind of rebuffed this past summer so it could be versatile for everyone on this call to use and folks in the general anti-hunger community. We'll be giving a few examples of how to use it, and then giving opportunities to essentially rate one particular COVID-19 response that everyone is familiar with. And then from there, we'll be talking about racially equitable responses to food insecurity during COVID-19, using a report that is so close to being published. I'm so excited. I'll be able to share the executive summary with you all, as well as some of the findings and recommendations. And then from there, we have questions. So as you all might be familiar with, I am definitely wanting to make sure that we're all on the same page and that we're working with this together. So feel free, if you have questions, to just go ahead and put it in the Q&A, put it in the chat feature. I will do my best, and I know Jessica has agreed to look through that as well. We want to make sure that you feel supported. I'll also be super interactive, so you'll have an opportunity to kind of engage with me and engage with the material. So without any further ado, we'll be talking about racial equity. This is really what's really kind of, important. So I have a question, and we're going to go ahead and start with, I'm going to invite you all to actually unmute yourself and speak. We can take about a couple of responses. Remember that you are being recorded, so if you don't feel comfortable speaking, it's also okay putting the response to this in the chat feature. How does racial equity connect with our mission to end hunger? So just go ahead and think about that for a little bit. Maybe as you decide to chat or even unmute yourself, we'll go ahead and take 2 or 3 responses. How does racial equity connect with our mission to end hunger?
I'd like to jump on that question.
Yes.
Hi, my name is Benu Amun-Ra. I go by she, her pronouns. And I like to address that in regards to the wealth of America has literally been built on the exploitation of Black and brown people. So when it comes to the food system and we think about history, we go all the way back to slavery. And in that, that's where a lot of the generational trauma stems from. And so when we think about racial equity, the workers who work in the fields get paid next to nothing, where they cannot even be able to sustain themselves, which is another reason why a lot of Black and brown communities have come together to combine their resources just to survive. And so that's why it should be a mission to end hunger, because the way that the food system is set up here in America does not allow for equity for Black and brown people. So
thank you so much. I really appreciate your comment. I'm just going to go ahead and sum what you set up. it sounds like you're saying racial equity is important to the mission of ending hunger because in many ways, as a result of structural racism, that has a direct lineage to a history of anti-Blackness within slavery. Black and brown people have essentially experienced the brunt of the inequity, which we can see in a variety of different ways, and hunger is one of those ways that we see that showing up as well. So I just want to say thank you and affirm your comment. Does anyone else have something else to share? And again, you can feel free to unmute yourself. You can also feel free to put it in the chat function. Okay, no worries. There's going to be a lot of opportunity for me to ask questions and so on and so forth. I actually wanted to share this this slide or this graph rather, and it's of a 10-year period. I did it a couple years ago, and you know, I like it because it shows right before the Great Recession and essentially like 10 years later, right, from 2007 to 2017. And I think oftentimes we're under the impression that, you know, race doesn't matter as much. I think in this year, I think we all attest to the fact that, you know, racial equity definitely matters. But we've still received that argument, right? And a lot of the times I think when folks think about the economy and the economy doing well, a lot of folks are not necessarily gauging it based on the current racial divides that we have. And I like to say that, well, right here, what we see is in 2007, African-American and Indigenous populations experienced food insecurity really anywhere between 4 to 5 times as much as their white counterparts. And this was when our country was doing economically well. Obviously, we see in the Great Recession that at the peak of it in 2014, that divide actually just increases, and food insecurity actually increases the most sharply for African-American and Indigenous populations. Now, getting back to to one of the comments that were made earlier, there's no coincidence why African-American and Indigenous populations essentially experience food insecurity at the highest rates. They also have the longest trajectory of racial historic trauma in the context of the United States. So it makes sense then that unresolved racial historical trauma for the longest period of time, right, in comparison to other groups in our country, that level of just unresolved tension, unresolved harm, unresolved, you know, racist structures and all of those other things, those realities create the conditions for essentially the highest susceptibility to something like food insecurity. So what does this prove, and why am I showing this to you? Well, it proves that race does matter because it is something as a result of unresolved racism before the Great Recession, when we were doing economically well, race mattered, right? African-American and Indigenous populations were anywhere between 4 and 5 times as likely to experience hunger. And that only grew when we were in economically poor times as well as a country. So this proves that we have to address race, because if we don't, if we only try to look at class, it's just not going, we're going to miss our mark of actually achieving our goal of ending hunger. So I'm wondering, some of you may have done the racial wealth gap learning simulation, which I am happy to say I designed. So some of you may have done that already, and I want to acknowledge that. Based on that, and also based on just kind of generally what you know about what you might be seeing at your food bank, what you might be looking at in your community, is it possible to end hunger without addressing discrimination based on race, structural racism? Why or why not? Let's just go ahead and have, I'm going to invite folks to actually use the chat feature this time. If folks can just go ahead and quickly put in the chat feature what their answer is to this question. I'm getting from Lori that structural racism also leads to economic disparities that lead communities that live in food deserts, right? And I'm actually going to offer another word for that, which is food apartheid. So we see that structural racism actually leads to creating areas of, thank you, Lori, areas that are very intentionally restricted from healthy foods, healthy transit, healthy amounts of income and other infrastructures that essentially make it difficult to access nutrition and access affordable and accessible nutrition. So thank you so much, Lori. What about others? What do folks think about this? So I'm getting from Dominique, absolutely not. You have to get to the root causes, one of which includes structural racism, to solve the wicked problem, i.e. hunger. Thank you so much. I'm getting from Amber, no, culturally appropriate food availability is limited. And then from Lana or Lena, sorry, I want to make sure that I'm saying your name correctly. We have structural racism perpetuates food insecurity by limiting access to resources that people need to eat nutritious food. And then lastly, we have from Lori, Pine Ridge Reservation is the size of Connecticut and only has 2 grocery stores. And I just want to affirm that piece. A lot of the time, you know, when we're thinking about hunger, unfortunately, we still don't think about Indigenous populations. And it's so critically important that we do. We think about areas of racialized concentrated poverty. And what I like to do is think about that in urban settings and in rural settings, right? And understanding that within that also encompasses reservations that were intentionally segregated. So thank you so much for bringing that up, Lori. I just want to affirm what everyone has said. So, and you're right, we cannot accomplish our goal of ending hunger without addressing structural racism. So I'm wondering how many people, I know this term has kind of been floated around, how many people have actually heard about racial equity, and how many people would say that they feel comfortable defining the term? Just go ahead and give some love in the chat. The other piece is, what is a definition, right? Maybe you've heard of this term, but what is the definition? Share what you think is the definition in the chat, and I'll go ahead and I'll read it. So while I'm waiting for that, while I'm waiting for the definition of racial equity from you all, there's a few more comments that came in. Every treaty has been broken, decreasing the access and stewardship to lands and waters. Yes, that can feed all. That's completely true. Thank you, Amber. And then Benu, I think, is no, you cannot separate food insecurity without addressing structural discrimination. The oppressive systems that are set up directly affect access to food, redlining, environmental racism, all factors to access to food. So I just want to affirm that. And I want to encourage folks, if you have not already done the racial wealth gap learning simulation, to do it. It actually walks you through how structural racism was created in the US and directly ties race with wealth, income, and hunger. So you can find that at bread.org/simulation. I can actually put that in the chat as well. And I don't see anyone providing the definition. Let me go ahead, simulation. You can definitely find it. I'm gonna actually open up the line. If, oh, it looks like, so if someone can unmute themselves and maybe give what they think the definition of racial equity is, that would be great. I just want to kind of gauge how this group is thinking about that. How would you define racial equity? So I'm getting in the chat, not equal. Equity is giving people what they need. And I'll go ahead and I'll stop it there. That was pretty straightforward, and it's an accurate representation of what racial equity is, at least a piece of it. So I really like to use this graphic. It's created by people of color. It's ably inclusive, which I love. And when we're thinking about understanding racial equity, it's important to understand the difference that it has with equality. Above, what we see is that equality essentially means equal inputs, right? So that means everyone gets the same bike, regardless of circumstance, need, or ability. With this, unfortunately, we do not receive the same outcomes, right? The same outcomes in this scenario would be optimally being able to ride your bike. That's just not happening, right? With equity, on the other hand, what we're seeing is that it focuses on needs, circumstances, and ability, right? So with that, body type and all that other stuff, right? With that, we see that the inputs are different, right? So in this case, everyone receives a different bike to conform to those needs and circumstances, right? The person on the left receives a differently abled bike to conform to her needs and circumstances. The person right near her is much taller and needs a larger bike to conform to his needs and circumstances. And then the person right to the furthest right has a smaller stature, right? So he or she needs a smaller bike, right? That kind of conforms to his or her needs. With this, the beautiful thing is that they all receive different things that kind of match what their needs are, kind of meet them where they are, and accept kind of like what the circumstances are, kind of, right? For them to achieve the equal outcome, in this case, optimally being able to ride your bike. Now, everyone is able to achieve an equal outcome, right? That's equity and equality. Now, when we translate it into racial equity, right? Because equity is not racial equity. When we're going deeper and we go specifically on racial equity, then you might be asking yourself, well, how do you determine what type of bike every community of color needs, right? And there are three simple things that I want you to take away. The first thing is historical trauma. So looking back, not 10 years, not 50 years, not even 100 years, but looking back centuries, right? So the first comment was really around, okay, slavery, right? For African Americans, we can safely assume that because we as a country have not successfully and vulnerably and honestly and openly addressed the historical trauma of slavery for Black bodies, then a lot of the things that we're seeing that disproportionately hurt us as Black people is going to be directly tied to the lineage of slavery, right? And physical bondage. For Indigenous populations, we need to look back to when land was stolen and there was genocide and treaties were broken and all of that. That is centuries long, right? So on and so forth. We need to look at the historical trauma. A good way to do that is ask yourself, well, why did that happen? Why did that happen? Why did that happen? You can also ask yourself, well, what is the origin of this, right? Black people were not always food insecure. Indigenous people were not always food insecure. So what caused that, right? There was a break, there was a break in something. What caused it, right? And it goes back centuries. So look at the historical trauma. The other piece is looking at the four types of racism and the four forms of racism rather, and how that's playing out, how that has played out historically, but then how it's currently playing out now, as well as the current barriers that are disproportionately hurting our communities. Looking at all of those combined will help inform really the type of bike, the way in which communities receive that bike, all of that. So I won't go too much in detail because of time, but I did want to share the scorecard because this is a really good tool that will help you, regardless of kind of where you're starting. You can use it right now today to help you essentially evaluate the policies that you support and the programs that you design, even the research that you engage in as a person, as an organization, and so on and so forth. And thank you, Diane. I was actually going to get to that as well in this piece about who builds the bike, because it really should be centered on community building the bike as opposed to white people and institutions continually perpetuating kind of that white saviorhood-ism or that white saviorhood kind of culture that continually kind of builds for as opposed to kind of stands in solidarity with. So again, and I'll just go back to it because I want to make sure that everyone's on the same page. I said all of these things should inform how the bike is built, how the bike is essentially given, but it also informs who should build the bike. And we know that it should be community driven, which means that we have to respect the needs and the leadership and the power of that community. So thank you, Diane. So I'm actually going to go ahead and just share for this. This is actually a super easy tool to work with. You can find it, and I'll give the website soon. It'll be on the chat feature. Thank you. Yeah, no problem, Diane. Thank you for your contribution. So you can really rank this from 0 through 5. And I think it essentially is like very, very straightforward. Our goal really is to make sure that all of the things that we do are at a 5. And within the anti-hunger community, generally, a lot of the things that we've kind of supported have generally been at like that 1 or 2 mark. Even though I think generally a lot of times people are like, oh, it's good work, so it automatically falls in a 5. So this helps us kind of self-evaluate where it falls. 0 is like harmful policy, right? It's almost explicitly racist, like the detention centers, right? We can say like that is explicitly racist and it's targeting communities of color in a negative way that's actually going to worsen racial inequities, right? The detention centers where it's literally 100% impacting Black and Brown people and communities, that falls under 0, right? Not every single policy is going to fall under 0, obviously, but that is kind of like the extreme, right? Just so that folks kind of have an idea. With 1, you're really kind of looking at broad-based policy that appears to be race neutral, but it's actually not race neutral, right? So it appears to be race neutral on the surface, but when you start looking at the provisions and the language, and when you start analyzing it, essentially going under the hood, that's how I like to look at it, is then you realize, okay, the language or how it's laid out to where, how it might be implemented, right? Like maybe a service is implemented in a bad way, or maybe the policy is implemented in a bad way. When you analyze it or when it's implemented, you actually see the negative impacts that it has on subgroups within communities of color at higher rates. So what this actually does is the provisions, right, that seem racially neutral actually worsen racial inequity. So I'll give an example. So in Nevada, when COVID kind of first took place and so on and so forth, there was a policy that said, hey, we acknowledge that people who are living below the federal poverty line need access to the internet. And because of that, we are actually going to focus on giving that access for $9.99 a month instead of kind of the general maybe $30 a month. Okay, on its head, it looks like it's pretty broad-based in the sense that, okay, people who fall within the threshold of being lower income, right, experiencing poverty, experiencing hunger, will by definition be able to benefit, right? So it's kind of broad-based in that, where it's like, it's targeted, but it's broad-based for all people who fall under that definition. Great. But there were provisions. It said, hey, we need you to have a good credit score, and hey, we need your social security number. So what does that do? Well, we know that because of racialized concentrated poverty that was built as a result of racist housing policies, that there are predatory lenders, right, in Black and Brown neighborhoods in particular, and that hurts credit, right? We also know other kind of racist acts and so on and so forth that really hurt our credit as well. So when you're looking at that, it's like, okay, well, we disproportionately have lower credit scores, so it's obviously going to impact us. The other piece is really around looking at undocumented immigrants, right? Which in the context of Nevada, the majority of whom are going to be brown. You're looking really at essentially excluding a whole group of folks who are 100% people of color from this provision. And what is this going to do? It's going to worsen racial inequity. So again, broad-based policies that appear racially neutral, but it has provisions, it has language that essentially is coded, right, that will have negative impacts on people of color and thus widen racial inequity. So that would be an example of that. Like 2 is really around broad-based policy, right? So it's broad-based and there's actually no provisions that harm folks. So when you're thinking about the same internet example, that would have fallen under 2 if it didn't have those negative provisions that really created more barriers for people of color to receive access, right? It would have just only been broad-based. And the thing with that is it maintains racial inequities, right? So it doesn't worsen them like 0 and 1 do, but they maintain it. So essentially, let's say I'm here, or let's say my best friend who's white is here, and then I'm here in terms of racial inequities, and we both get a bump in receiving internet. Okay, that's great. So it's the same input, and as a result of it being the same input and not necessarily targeted, we just maintain the same level of inequality that already existed between us. Think about that for 2. Now, jumping to number 5, that's when the entire policy prioritizes racial equity. That is really, I think, important. This directly puts the needs, the leadership, and the power of people of color at the center from the beginning, from the inception of the idea to the design of the policy or program, to the implementation of the policy and program, to the evaluation of the policy and program. And in addition, all of the recommendations, all of the processes specifically account for and are proportional to the historical trauma that took place, right? This is critically important. Proportionality is important, right? If it's not proportional to the scope of the problem, it's not proportional to the historical trauma that a particular community has experienced, then the recommendation will never fully be able to reach its fullest potential of actually closing the racial divides that we currently see today. And I think I see something in the chat that I'll go ahead and, okay, awesome. So let me just move forward. So there are a few principles that the Racial Equity Scorecard shares, centering the needs, leadership, and power of communities of color first from the beginning, right? Inception, design, implementation, and evaluation on all stages, and they are respected as not only equal partners, but the leaders, okay? The other principle is to name each community of color separately, right? Not to use terms like minority because that is problematic for a variety of reasons, but to also say, okay, well, clearly we know that Native Hawaiian communities versus Latino communities versus African-American communities versus indigenous populations and so on. So there are differences, right, in historical traumas. There are differences in analyzing why each, in analyzing the outcomes for every community, and also analyzing the why behind why there are different outcomes. We know that there are going to be shared trends, but there are different whys. There are different historical traumas, right, for why we're seeing a difference in the outcomes, right? The fourth thing is to set up a responsive recommendation, right, that's proportionate to the historical trauma that we talked about, right? So in the case of COVID in Michigan, 40% of folks who were dying from the disease, from the virus rather, were African-American, even though we only represented about 20% of the state's population. So any COVID-19 response should make sure that at least 40% of all of the support go directly to African-American populations because they're dying at 40%. Proportionality is key. And I said at least because if you account for historical trauma, it would actually be a lot more than that. I'm gonna go ahead and see, I see a chat, 30 minutes left, got it, thanks. Okay, and then the other piece is to include robust implementation and monitoring. So policies like the Civil Rights Act were good, but the bad thing about it, unfortunately, is it didn't include robust implementation or monitoring. So it really, a lot of it got left unchecked, a lot of it got left unenforced, a lot of it got left unimplemented, right? So we need a racially equitable implementation plan as well for for policies as well as for programs that are designed, that's critically important. And if we're missing that piece, and if it's not grounded in historical trauma for maybe how community might relate to certain things as a result of historical trauma and all that stuff, if it's not grounded in that, then we will not see racial equity come into fruition. So I'm actually going to go ahead and give a quick example, because some of you might be like, okay, great, this is good, but how do I apply it? And I want to help you apply it. So everyone should be familiar with the stimulus checks. How many folks would say that the stimulus check, that policy response applied a racial equity lens, and how many folks would say it did not? Just go ahead, quickly share your thoughts in the chat, and we'll be able to, and I'll just go ahead and I'll just kind of piggyback off of what. Okay, so Lori said it did not. Lana said it did not. Amber said it did not. Megan said it did not. Dominique said it did not. Denise says it does not. Okay, awesome. So you all are on the right track. I just want to affirm what you said, and I want to thank you for your participation. So just kind of as a recap, in response to COVID-19, the IRS issued $1,200 via bank accounts or physical checks to all households, regardless of anything, right? And we know that these are all the kind of the 5 core principles. It did not center the needs, the leadership, and the power of people of color, right? It did not even look at some of the outcomes or anything like that. But when we're looking at the actual scorecard, right, 0 through 5, many of you said it did not. But my next question is, go ahead, put in the chat, where would you rank the stimulus check and why? Would it be a 0? Would it be a 1? Would it be a 2? Would it be a 3? Would it be a 4? Would it be a 5? Just go ahead, put it in the chat. Okay, so Dominique says 1. Megan says 2. Is it Kia? That's really cute. That's a cute way of spelling it. 1. Brianne says 1. Lana says 1. Troy Vos says 1. Okay, I want to know, I want to hear from you all. Why? Why are you saying 1? And feel free, if you answered any of that, to go ahead and unmute yourself and share why you shared 1 as well. You don't only have to chat. If you feel more comfortable chatting, you can, but feel free to also unmute yourself, and you can share with the group why you shared 1, 0, or 2.
This is Lana. Can you hear me?
Yes. Hi, Lana.
Okay. Hi. And yes, you're pronouncing my name correctly. I said 1 because I feel like, going back to what you were talking about, kind of like with the fine print, there were these stipulations that were applicable for it. So like you had to file your tax return, and they used the address that they had on file, that sort of thing, but not taking into account that not necessarily everyone is filing a tax return or had filed at that point. And yes, they put whatchamacallit, like a limit on your income. So if you made over a certain amount, you didn't get the full 1,200, but it just didn't seem like a fully fleshed out idea that was equitable across the board, if that makes sense.
Yeah, thank you so much, Lana. I appreciate that. Thank you for your contributions and for sharing those very specific points. Dominique also shared the stimulus checks used a broad-based approach to attempt to stimulate the economy without taking racial equity or other forms of equity into account. And it was based on your income from 2018 also. So I want to go ahead and affirm that the stimulus check does not apply racial equity lens at all. So it does fall between 0 and 2. At first, some folks might want to say, oh, well, since everyone received 1,200, then it maintained the racial inequities, right? But then when you look at some of the provisions, like the IRS made a rule that essentially really prevented a lot of people who are returning from incarceration from receiving the stimulus checks. So that's one. The other piece is the fact, and we know that through anti-Black policies, that Black and Brown people are majorly impacted by incarceration and over-policing and racial profiling, right? So it's disproportionately hurting our families. The other piece is that as a result of a history of distrust, as a result of a lot of things, we don't actually trust the bank as much. And we also are more unbanked and underbanked. So giving it to a physical bank is problematic because we don't necessarily, as Black, Indigenous, and other people of color, we have lower bank rates because there is that lineage of just not trusting the bank. So that's problematic. But then you also have another provision, which is that you have to have your social security number. So then that means that a documented majority people of color are not going to be able to receive it, which means that we're going to actually worsen the racial inequities during COVID-19, right? These are just some. There are a litany of provisions, but these are just some of the top highlights as to why, on the surface, giving everyone $1,200 seems like it's broad-based. So that makes sense why one would pick two, right? But because of those provisions, we see that it's actually a one, right? It actually worsened racial inequities because to this day, a disproportionate amount of Black and brown people falling under the poverty line have not received it. And guess what? They need it the most, right? On top of the fact that they would need more than just $1,200, right? It would need to be more to account for the racial wealth divide that they're experiencing. It would need to be more to account for the higher levels of unemployment that they're experiencing. It would need to be more to account for the added expenses related to the digital divide and all of those different things. It would need to be more. And because it did not actually center the needs, the leadership, and the power of people of color from the beginning, right? Then it makes sense that the design, the implementation, and even the evaluation of the stimulus program was flawed, right? So I want to go ahead and check the chat. Absolutely, many don't have bank accounts, 0 because it's unintentionally racist. Okay. I wonder how many low-income people still haven't received. It's definitely millions. I don't actually know what the breakdown is, unfortunately. I don't know if that analysis is, if we're even able to do that at this point. I'm sure probably in a year or two we would. Okay, so we only have a little bit left. So I want to actually just go ahead and read the executive summary report, okay? All the things that I teach, I also preach. So this is an example of a way that, you know, all of the scorecard and stuff like that, that's actually used. There are a ton of examples in this summary, and it directly helps us understand how we can apply a racial equity lens to our COVID-19 response, because our COVID-19 response has not done that. You can find it at broad.org/racial equitable responses. And you can find the scorecard at broad.org/racial equity. So this is kind of like a quick summary. So according to the Color of Coronavirus Project, the deaths per 100,000 people in each group are essentially 80 Black people, 67 Indigenous people, 59 Pacific Islanders, 46 Latino or Latinas, compared to 36 white people. So essentially when you account and you adjust for age, then we see that Black, Indigenous, and other people of color are 3 times as likely to die as their white counterparts in the same age group. So if that's not racial inequity, I don't know what is. In response to this report discusses the unique impacts of both COVID-19 and other factors that increase hunger among communities of color within the context of anti-Black racism, which is a root cause of racially inequitable impacts that we're seeing, right? That helps to explain why we see the first bullet point. The second thing that this report does is it says, hey, we need to focus on racial equity, but in order to apply a racial equity lens well, we need to be honest about not just saying racism, we need to be explicit about saying anti-Black racism. And guess what? We can't just go that step further, we have to go another step further. And we have to center the needs, the leadership, and the power of Black women more specifically, because not only is it important to center Blackness, it's also important to center Black women, because Black women have the interwoven intersectionality of racism and sexism combined. And if not addressed, we will not fully be able to really uplift the plight of other men and women and children of color with everything, but specifically with food insecurity. So I just want to encourage you all, definitely read the full report. I'll make sure to circle back with folks from the Alliance to make sure that you all get it once it's out. But one of the main findings from the full report, from the original analysis that was done, is that race was the most important factor in determining one's risk of contracting COVID-19 and dying from COVID-19 once they contracted it. The number one, above things like age and health, like what we were hearing from in March, in April, and even now, people are like, okay, if you have an elderly, so on and so forth, it's like, yeah, that's important. Pre-existing health conditions are important, but our research proves that race is actually the number one factor, even preceding things like health and age and so on and so forth. So some of the main findings is essentially that Black, Indigenous, and other people of color, we know that we're exposed at higher rates. I won't go into that too much because we don't have a ton of time. But a lot of that is within a lineage of anti-Blackness and looking at slavery, where essentially we were segregated into the 10 lowest paying jobs. And these are still considered essential, right? But it's more of essential jobs as opposed to essential workers, right? Because we've proven with our anti-Black practices that we don't actually really value workers, right? The other piece is that we know that Black, Indigenous, and other employees of color were more likely to be laid off too, right? So it's kind of like that, like the irony of the other flip of the coin, right? This is because, again, we were mainly disproportionately impacted in sectors that were hurt by stay-at-home orders, right? So that includes, like, travel industry, hotels, so on and so forth. In addition, we know that we experienced racial biases in healthcare, which essentially hurt us when we're thinking about, COVID-19, death rates. It actually increased it, right? A lot of reports documented, the African-American people, in particular, African-American women, were denied hospital care, and they had to return several times because they were denied full examination of COVID-19. Again, just kind of dating back to the fact that, apparently, Black people don't necessarily hurt in the same way that white people do. So our concerns aren't necessarily taken with the same level of respect and care as they should. In addition, when we're thinking about some of the main findings that the report focuses on, is also racist housing policies that essentially create conditions of racialized, concentrated poverty and environmental racism that really expose us to a litany of toxins that really kind of compromise our immune system and compromise our respiratory system, which therefore leaves us more susceptible to contracting and dying from COVID-19. So some of the recommendations, really quickly, there are a lot of recommendations, and the full report actually focuses on the racial wealth divide, racism more kind of at broad, food insecurity, racialized concentrated poverty, and health, and like just kind of racism within the healthcare system. The executive summary is much shorter. It's like only 1 or 2 pages, and it only has like kind of 10 short ones, right? So just know that, in the longer report, it has a little bit more, understanding the fact that we have to really look at this in a comprehensive, holistic way. But these are some of the 3 that directly focus on hunger. The others focus on increasing on hunger, but a little bit more indirectly. So recommendation 1, policymakers should use available racial equity tools like the Racial Equity Scorecard that we went over today when they design and implement programs and policies. That's critically important. They did not do that. They need to start doing it, and they need to make a commitment to doing it, and we need to push them to do that. The second recommendation is to change SNAP benefits to essentially provide additional support to Black, Indigenous, and other households of color, according to and accounting for gender inequity as well, in proportion to how households have really been impacted by COVID-19 and how this is, as well as the racial wealth divide, right? So we know that among the lowest income threshold, unfortunately, there is a racial wealth divide, but it actually increases. It increases among people who are experiencing hunger, who are experiencing poverty. And a lot of people don't necessarily realize that. A lot of folks have said, okay, well, class is class. Okay, well, you know, there are poor white people too. And yes, there are poor white people too, but guess what? The racial wealth divide increases at that lower income threshold, which means that while there are poor white people, the Black, Indigenous, and other people of color living in that threshold are actually suffering a lot more, because they are not only receiving that lower income, but they're also met with the added layer of not having the wealth to kind of fall back on, whether it be through land or liquid, or through home ownership, right? Those are really critical things. And because of that, we need to make sure that, and we know that also Black, Indigenous, and other households of color actually run out of food much quicker, right? Imagine for a crisis, right? We saw the graphic for the Great Recession. The crisis peaked at 2014, and guess what? Who experienced the highest levels of hunger? It was Indigenous and African-American populations, followed by Native Hawaiian and Latino populations. That's critical. That's probably what we're seeing today too. If that's the case, then we cannot say that we're serious about ending hunger and we understand that there are racial inequities without saying, hey, programs that we care about need to apply a racial equity lens. That means that Black, Indigenous, and other people of color receive additional support to account for the fact that they are experiencing harder hardships, quite frankly. So that's what we're asking for. And then the third recommendation is to change the USDA interpretation of emergency SNAP benefits to be racially equitable. Unfortunately, right now, folks who were already receiving the maximum level of SNAP, disproportionately going to be Black women living in the South, more specifically. They were excluded from receiving additional SNAP benefits when for the emergency COVID response. That's problematic because these households are probably suffering the most, right? So that needs to be changed, and the rule really needs to be amended to change so that these households actually receive additional support, right? But it needs to be additional support in relation to the impact, the racialized impact that COVID-19 is having on lower income Black households, and by extension, other households of color. So those are the top three. I want to go ahead and open it up to questions for folks. Just so you know, you can go to bread.org/racial equity. You can also go to bread.org/racially equitable responses. The first is for the scorecard and the second is for the report. And then I'll also make sure that it's included in whatever follow-up material that the Alliance is presenting. So I'll go ahead and I'll open up. It was really great spending the last hour with you all. I'm looking at some of the chat right now. I'm seeing, thank you so much, Marlysa. This was so informative, much needed. Thank you so much. Thank you. For folks who might have questions, feel free to go ahead and unmute yourself, or you can put it in the chat function like we've been doing. So I'll go ahead and I'll be quiet now to kind of allow you to unmute yourself if you want. Thank you, Diane. Thank you, Lana. Do folks have any questions? We have more than enough time. There's no need to rush. I'll just go ahead and type in.
I just want to say that I love the fact that the equity model image that you have is also ableist. I love that. And congratulations for doing that.
Yeah, it was actually created by two women of color. I didn't create it, but I make sure to try to use it, you know, things that were created by people of color. And I also appreciate how it's ably inclusive. So thank you so much for that, Lori. Any other comments? Any other questions that folks might have? Maybe you might say, hey, I want to start using the scorecard, or a question about the recommendations. Anything that you all might have.
I would like to start using the scorecard. We have a anti-racism transformation team at our food co-op. I'm on the board there. And I think that would be an excellent tool for us to use when we look at our policies and procedures. I would very much like to use the scorecard, to introduce the scorecard to our team.
That's exciting. I think that's a good next step, to use it for your policies, for procedures. It can honestly be super versatile, where you can look at it more internally and do that. You can do it within your individual work plan as well, for all the projects that you decide to do. And you can also look at it for some of your more outward facing things, like creating services, designing services, and or designing policies. So thank you so much, Lori. I'm seeing some in the chat. Megan, I'm new to this issue professionally, so I don't know enough to ask anything. However, this was great information. I will continue to study it. Thank you. I should have clarified, new to the anti-hunger. Yeah, thank you so much. All right, well, I'll go ahead and I'll open it up one more time before I'll pass it on to Jessica. Does anyone else have anything else to add? So I see in the chat, we have Hannah. We work with college students, and I love to start using the scorecard with our campus advocacy, and for our students to use it in reference to campus food and security policy on college administration level. I think that's an awesome idea. I think it's good to use it in advocacy, because a lot of the times as an anti-hunger community, I think we think go, 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 right? And that's important, but the go, go, go model is not necessarily the racially equitable model, because it's not necessarily centering the needs, the leadership, and the power of people of color from the inception, right? So I think that would be really, really great to center the needs, the leadership needs, leadership, and power of people of color from the inception of even thinking about how you advocate, right? And co-creating that, and really taking the lead of the people of color in your community and essentially standing in solidarity with, you know, as you're kind of co-creating that new campus advocacy model that you might have. I think that that's awesome. So thank you so much, everyone. This was really great. I loved kind of the intimate setting that we were in. I appreciated everyone participating on the chat and even unmuting yourself. Feel free to email me at mgamblin@broad.org. And again, you can go to broad.org/racially equitable responses, as well as broad.org/racial equity for the scorecard and for the executive summary. I'll pass it on to Jessica. Thank you.
Thank you so much, Marlysa. What a great session. I just want to once again give you a huge thanks and virtual round of applause for sharing your expertise with all of us today. For everyone in this session, please keep the questions and conversation going in Whova. You can access that at any time by clicking View Session from the agenda. Coming up next is a panel discussion focused on how corporations respond to hunger during COVID. We look forward to seeing you there. So feel free to take this 5 minutes, take a break, and then we'll see you in the next session. Thank you all.